I'm Sanne Magnan, co-chair of the Roundtable on Population Health Improvement. I welcome participants to our event today, workshop in New York City, and participants who are viewing the live and recorded webcast of today's event, which is titled Reorienting Healthcare and Business Investment Priorities Towards Health and Well-Being. I'd like to extend our thanks to our host, NYU Langone Health, and Marc Gourevitch, Chair of the Department of Population Health. Marc, if you'd like to give a welcome.
Thank you, Sanne, and thank you, everyone. Good morning. Welcome all. My name is Marc Gravich, and I chair the Department of Population Health here at NYU Langone, and it's really a great pleasure to welcome you here today, the Surgeon General, our distinguished speakers, members of the IOM, the NAM, forgive me, Roundtable on Population Health Improvement, and participants. It's a particular pleasure today to be here with you because our department's themes that it really focuses on are so aligned with the themes we're speaking about today. Sort of thinking about partnerships, thinking about the role of not just healthcare delivery, but of other sectors in advancing the health of populations, and in thinking about advancing population health and health equity more broadly. So it's just we're a group of about 90 plus sort of basic and applied research faculty with expertise in a broad range of disciplines. And it's very much a pleasure to welcome you here today and to engage in this conversation. So thanks.
Thank you, Marc. Since February 2013, the Roundtable on Population Health Improvement has been providing a trusted venue for leaders from the public and private sectors to meet and discuss the leverage points and opportunities arising from changes in the political and social environment for achieving better population health. The Roundtable's vision is a strong, healthful, and productive society which cultivates human capital and equal opportunity. This vision rests on the recognition that outcomes such as improved life expectancy, quality of life, and health for all are shaped by interdependent social, economic, environmental, genetic, behavioral, and healthcare factors, and will require robust national and community-based policies and resources to achieve that vision. The Roundtable has hosted a number of conversations on the topic of resources, one of the key areas of influence for improving population health. We should have a slide coming up that will show some of the workshops on the topic of resources, as well as our multiple areas of influence that include resources. Our co-chair, Emeritus David Kindig, asserted 20 years ago in his book, Purchasing Population Health, Paying for Results, and I quote, that population health improvement will not be achieved until appropriate financial incentives are designed for this outcome. This statement is as true today as it was 20 years ago. As seen in our workshop infographic, and those of you who haven't picked it up or looked for it online, please do. It is a great summary of how we're moving from value to investment in population health and well-being. That we can show that we are moving in the right direction, but with the recent report of declining U.S. life expectancy, there is much more to be done. Today, we will consider how economic priorities are beginning to shift towards that investment in health and well-being for all, and to consider the leadership roles that we must play to make the powerful connection between health and wealth flourish as much as possible for everyone. As part of the planning committee with staff, I am grateful to the following additional committee members who devoted time to develop this workshop: Bobby Milstein, Kathy Bozzi, Jim Nickman, Lisa Richter, and Mylyn Tufte. Bio sketches for them and today's speakers, as well as a bibliography, are included in your electronic meeting materials, including that infographic that's intended to serve as a learning aid today. All are available on the meeting page, and a proceedings of the workshop will be prepared by an independent rapporteur. And all participating today will be notified of its publication. If you are on Twitter, please use hashtag #PopHealthRT. At the end of today, my fellow co-chair, Josh Sharfstein, will make brief reflections on the day and welcome those from other members and from participants. I'd now like to introduce Bobby Milstein, Director of System Strategy at ReThink Health and the lead facilitator of the Roundtables Working Group on Resources, who will give us our charge for today's workshop, as well as an overview of the day. So, Bobby.
Thank you all for coming. As Sanne said, there's been a long history of work leading up to this, going back decades, and you know, a lot of that has focused on particular aspects of the resource flow and the mechanisms that allow resources to flow from one party to another, and the topic areas in which they focus. The charge today is to take a much more macroscopic view on a macroeconomic opportunity that we face, and also an imperative that until we really bring the value for health and well-being into our markets, we're not going to see the full potential for health and well-being to flourish. So that was sort of the genesis of the design of today. We'll get some slides up here in a minute. I just wanted to sort of give us a little bit of an orientation on the design of today and what you're about to hear, and some of the highlights of this infographic. So we'll get those slides going here momentarily, I hope. A lot of this is visual, meant to go quickly, so I can paint a picture verbally if needed, but get that going. The computer's frozen. Okay. Okay. Well, in that case, the key thing to know about this is that we see a situation in flux where there are changing concepts of both value and investment, and those have the potential to shift whole sectors of the U.S. economy. For today's workshop, we've really spotlighted two: healthcare and business investments. Of course, these overlap to some degree because in the last 50 years or so, healthcare itself has become a big business, and everybody's familiar with the rising cost, as well as the vast potential to improve relative to other countries in the world, and even subgroups across the U.S. So what we've done today is to design a bit of a good news, bad news story that will go through forward, and we'll go through in a sort of spiral way. There's a main line through it, which is this big macroeconomic story of where are we in a shift toward valuing health and well-being in our markets. The good news is that this is now a visible priority, not just for the National Academies, but for the forthcoming Healthy People 2030. Architecture is built around the idea that investing in health and well-being will be good for society and as well as its people. Amazingly, in 2019, the Surgeon General, really for the first time in American history, will lift up the idea that health and the economy are intertwined in ways that we have really not fully understood before. And that promises to be a landmark. We've got the Surgeon General with us today to narrate, the rationale for that historic priority. But at least in the health landscape, the healthcare landscape, we are at a unique historical moment of recognizing the health and economic dimensions that have always been there but have never often been lifted up as a priority. The same is true in the changing world of business investment. There are landmark documents that the Federal Reserve and the Nonprofit Finance Fund have demonstrated what investing for results and value could look like. This is not an area of scientific uncertainty. It's a question of leadership. And even there, today, there'll be the release of the Just Capital rankings, second year of showing that companies that actually treat their workers better, pay their workers better, create safe workplaces, create better safer products, and are involved in their communities actually not only do good in those dimensions, but actually perform economically even better. And we are just a week or two away from a landmark publication of metrics to focus on business value around long-term productivity. That is a consortium, the Coalition for Inclusive Capitalism, representing 30-plus organizations and $30 trillion that they affect, that has now demonstrated that there is a platform on which business investments can focus on the long term and really ought to, and if not, at their peril. So there's a leadership opportunity that is qualitatively different in the wake of the steps that others have taken prior to today. And that was really the focus of our discussion today, is the leadership opportunities. The agenda is designed to move from sort of whole sector panels that focus on sort of the landscape of what's going on in healthcare and in business investments. That'll happen in the morning. And then there'll be selected leadership stories from healthcare and business investments that don't look at the entire sort of macroeconomic landscape, but within the walls of specific institutions, and how do the leaders of those institutions see themselves as part of a sort of a changing landscape, and what they're doing to reposition themselves and their priorities and their relationships and their investment agenda differently going forward. So none of that is going to divert us from the through line here around the larger economic challenge, but we will look specifically in these two sectors, and then we will end with a bulk of the day, really at the end of the day, is in a leadership role play that all of you as participants will be part of. So listen very carefully, take notes, be creative. This is a workshop in the very real sense of the word, that the work ahead for this is not about observing and commenting on what should or ought to happen. It's really about people putting their leadership and their muscle behind making this happen. And I can't think of a better person to do that than the U.S. Surgeon General. So let me invite Kathy Bossi, my colleague from the Roundtable, for folks who know Kathy, she is one of the world leaders in thinking about how business investments can marry with health and well-being. So Kathy, please.